everyone, and thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. The month of June is known as National PTSD Month, and today we are joined by Dr. Sarah Gilmore. She's with Piedmont Macon, and she's here just to talk more about it. So thank you so much for joining us, Dr. Gilmore.
Yes, thank you for having me. I'm excited.
Thank you. Thank you. So the first question I have for you, what is PTSD?
Yeah, so PTSD is how the brain responds when an individual has either witnessed or has seen a trauma or personally experienced a trauma itself. And so it's the way that the brain tries to prevent itself from experiencing yet another trauma. And you can see that by how some of the symptoms are related. For example, you think about avoidance behaviors. We see that pretty commonly. So for example, let's say trauma happened in somebody's hometown, so they might avoid going back to their hometown because it reminds them too much of that trauma. Another thing is you look for people who are really hyper vigilant. So these are going to be people who are always on guard, always very alert, even though there might not be a perceived threat, but they just always feel like there's threats around them regardless. Another thing that you think of is someone who has a lot of flashbacks, which is just feeling like you're right back in that trauma, you're reliving that experience all over again. Other common things that you'll find with PTSD are called dissociations. So that's when either you feel like you aren't real or the around you aren't real. And so this is kind of how the brain tries to protect itself from that trauma and from having to go through another trauma.
Okay. So I would say, what are some signs to look for, with, our loved ones experiencing PTSD? What are some signs to look for?
Yeah, so if you've noticed that an individual who once enjoyed going out and let's say playing golf, all of a sudden just wants to stay home all the time, no longer interested in doing the things that they used to enjoy doing, that can be a sign of PTSD. Another thing is substance use is very, very common to help cope with PTSD, especially with alcohol use. Individuals who are experiencing kind of more irritability and anger, where it might be out of proportion to that specific event. You also see people who struggle with insomnia, and they might have nightmares about that specific. Those are all very common signs to look out for.
Okay, so are there any treatment options available for those who, are dealing with this disorder?
Absolutely. And the treatments are really well researched and can be very, very helpful. And the basic thing to remember is the sooner you get help, the better the prognosis. So you like to start with therapy first, and there's several different types of trauma-specific therapy. So there's exposure, which has been in place for quite some time. There's trauma-specific CBT, which is cognitive behavioral therapy. There's cognitive processing therapy. There's one that's up and coming and well-researched called EMDR as well. There's also group therapy for trauma survivors. So there's a lot of good therapy options. Medications can also supplement therapy as well. And so if you're considering getting on a medication, it's best to meet with either your primary doctor or your psychiatrist. There's really good treatment options available.
Okay. So last question, in addition to those group therapy sessions that you mentioned, are there any other ways that, a person can support one of their loved ones with PTSD?
Yes, absolutely. So it's very tempting to want to give advice to patients who have PTSD and to loved ones with PTSD, but the best thing that you can do to support somebody is to them and to try to refrain from advising them, try to refrain from pushing them to talk about the trauma. There are going to be individuals with PTSD who really enjoy sharing about that past because it makes them feel better. But there are also going to be people who really do not enjoy talking about it because they just want to keep it in. And so everyone is going to handle that differently. So what it's best for you to do with a loved one is to kind of just let them decide how they want to deal with their trauma, but to be there and to encourage them to get help, and also to provide a list of resources for them to get help.
Okay. Well, thank you so much, Dr. Gilmore, for just sharing this information with us. And I hope that it will benefit a lot of, those that are suffering from this. Thank you.
I'm Jeremy Rozier, owner of Rozier Restorations, Macon's premier home restoration specialist. We are restoring this 140-year-old home on Arlington Place back to its former glory. Just one of the countless projects we've completed, and we can do the same for your old home. From roofing and siding, windows and doors, kitchen and bath redesign to full plumbing and electrical, Rosier Restorations is a full-service, one-stop shop for historic homes restored right. Rosier Restorations, we bring history back to life.